The World Health Organization has classified ME as an organic neurological disorder since 1969 and continues to do so. The illness can occur in both epidemic and sporadic forms. Over 60 outbreaks of ME have been recorded around the world since the 1930s. The illness is initiated by a viral infection which targets the brain. This viral infection causes post-encephalitic damage to the brainstem. The brainstem is a nerve center through which the brain controls all vital bodily functions. Every person who has ME has this type of damage to the brainstem. It is essential for the diagnosis because this damage is what ME is. Although ME is primarily neurological, because the part of the brain which lets it control the rest of the body is damaged too, there are also problems with almost every other bodily system. Because so many bodily systems are affected, it isn't surprising that so many different symptoms are seen in ME. Another way of saying all this is to say that people with ME have lost their normal internal homeostasis. Homeostasis is a process by which the body adapts to changes in the internal and external environment to keep the body functioning within normal limits. This loss of homeostasis means that the bodies of people with ME react abnormally to everyday pressures such as physical activity, cognitive exertion, sensory input, orthostatic stress, emotional stress. Almost no bodily system reacts as it should to these very normal pressures. These problems combine to create a high level of disability for people with ME. This is not just about physical disability. For many people with ME, their cognitive problems with thinking, speech and memory, etc., are by far their most disabling symptoms. What happens when a person with ME is too physically active or is upright for too long is a period of time in which the person experiences a whole host of different symptoms all at once, as the body struggles to cope with what is happening. All of these symptoms combine to create severe and overwhelming episodes of illness that are unique to ME. They can be profoundly incapacitating, and at their most severe, the patient often feels as if they are going to die. The level of physical or mental activity or sensory input, etc., needed to cause these symptoms varies from patient to patient. It is often trivial or very small compared to a patient's pre-illness tolerances and abilities. The severity level of the symptoms produced varies widely between patients too, and ranges from mild to very severe. The symptoms produced may also be life-threatening in some sufferers, for example, seizures and cardiac events. The onset of these symptoms may be immediate and sudden, but often the symptoms will not peak until 24 to 48 hours or more afterwards. These symptoms can then persist for hours, weeks, or many months or longer. Relapses of symptoms caused by physical activity, etc., can also be delayed and accumulate over time until they are realized in a crash. A crash is a period of intense worsening of the overall condition, followed by a gradual return to the person's usual level of illness. When this happens severely or repeatedly over time, these relapses can also build up or accumulate and become more permanent. When this happens for long enough, the person becomes unable to return to their base level of illness at all. Long-term or permanent worsening of the overall severity of the condition is caused. This is particularly true with regard to physical activity. Being too physically active, even for just a short period of several days or weeks, can cause relapses which last many years, or from which the person never recovers. This is why it is vital that people with ME must be very careful to avoid physical overexertion and should never be encouraged to exercise or be active beyond their individual limits. This is particularly important in the early stages of the illness, but also at any stage of the illness. Rest in the early stages of the illness is also the best predictor of a positive prognosis, and so is very important. In addition to the risk of relapse, permanent damage, for example to the heart, and disease progression, there have also been reports of sudden deaths in ME patients following exercise. Other symptoms of myalgic encephalomyelitis include sore throat, chills, sweats, low body temperature, low-grade fever, lymphadenopathy, muscle weakness or muscle paralysis, muscle pain, muscle twitches or spasms, gelling of the joints, hypoglycemia, hair loss, nausea, vomiting, vertigo, chest pain, cardiac arrhythmia, resting tachycardia, orthostatic tachycardia, orthostatic fainting or faintness, eye pain, photophobia, blurred vision, wavy visual field, and other visual and neurological disturbances. There is also hyperacuity, tinnitus, alcohol intolerance, gastrointestinal and digestive disturbances, allergies and sensitivities to many previously well-tolerated foods, drug sensitivities, stroke-like episodes, nystagmus, difficulty swallowing, weight changes, temporal lobe and other types of seizures, and an inability to maintain consciousness for more than short periods at a time, mental confusion, disorientation, spatial disorientation, disequilibrium, breathing difficulties, emotional lability, sleep disorders including sleep paralysis, fragmented sleep, difficulty initiating sleep, lack of deep stage sleep and or disrupted circadian rhythm. And finally, there is also neurocognitive dysfunction. This may include cognitive, motor and perceptual disturbances. Cognitive dysfunction may be pronounced and may include difficulty or an inability to speak or understand speech, difficulty or an inability to read or write or to do basic mathematics, difficulty with simultaneous processing, poor concentration, difficulty with sequencing and problems with memory, including difficulty making new memories, difficulty recalling formed memories, and difficulties with visual and verbal recall, for example, facial agnosia. There is often a marked loss in verbal and performance IQ. All of this information is not just an unproven theory. It is based upon an enormous body of clinical information and research. More than 1,000 individual studies support this theory, and newer research continues to do so. Tests such as PET and SPECT scans and many others also strongly support this hypothesis. In closing, myalgic encephalomyelitis has nothing to do with fatigue and being tired all the time. Neurological illness, ME, bears very little similarity to any of the definitions of CFS.